So today we're going to be talking about the silent bone thief, and I'm talking about the condition osteoporosis. There's also osteopenia, which is a stepping stone towards osteoporosis. Again, like usual, we're going to start with some definitions. What is osteoporosis? Well, osteo is bone. Osis often describes a process, and porosis is a process of becoming more porous. So bones getting more porous, or in layman's terms, your bones are thinning. It can happen at any age, but it does happen more commonly as we get older. As you start to move from normal bone tissue to slightly thin tissue, we call that osteopenia. As it goes into fully thinned bone, we call that osteoporosis. So let's think a little bit into what's happening in the normal skeleton and why this matters and why it goes wrong. So bones have two areas of the bone. There's the outside part of the bone, which is thick and fairly solid, and then the inside part of the bone, which is more like a honeycomb structure, and inside that is the marrow. And the bone is not a defined and fully built structure. Obviously, it grows as we grow, but it isn't something that gets to maturity age 18 at the end of puberty and remains static. It is constantly being eaten up by specific cells called osteoclasts, and then being placed down again by cells called osteoblasts. And that exists in harmony to sort of maintain and repair and rebuild the skeleton. And that happens in most people fairly effectively, but as we get older, becomes slightly less effective. Unfortunately, we build up our maximal bone density quite early on in life. So actually, by our mid-20s and by 30s, we've probably built up the biggest and heaviest skeleton that we're going to get. And at that point onwards, slowly our skeletons start to be resorbed more than they are rebuilt. So it's likely your bone density will slowly and gradually decline. But that process obviously can go wrong much faster if there's an imbalance in some of the ways in which it's controlled, or in the nutrients that you need, or in drugs that we've given as rheumatologists and as other specialists. Firstly, let's think about what you need. Well, most people know that the bone contains calcium. Obviously, if we're not having much calcium in our diet, you're going to struggle to build up the bone. To absorb that calcium, you also need, and use that calcium, you need vitamin D. So a diet that has adequate dairy or supplementing with vitamin D and calcium is important. Vitamin D is mainly made from the sunlight. If you cover your skin all the time, or you have a darker skin tone, you may need more sunlight to achieve the same amount of vitamin D production, but it's quite easy to get as a supplement over the counter. The bones don't just need to have the building blocks, but they need some stimulation, and they're stimulated by weight-bearing activities. So in our youth, the best thing we can do, alongside having a healthy diet with plenty of vitamin D and calcium, is to do weight-bearing activities and sports, because that will stimulate the bone to grow and get stronger and build the stronger skeleton that we can by peak bone mass density around 25 to 30. As it slowly declines, factors that influence women much more start to take over. Sex hormones, estrogen, in particular the estrogen-progesterone ratio, and all of the changes that happen around menopause, where these hormones plummet, makes a big difference in how bone turnover happens. So alongside some of the menopausal symptoms that can themselves be distressing, one of the things that puts women at particular risk over the age of 50 is menopause and the impact that has on bone health. That's why we see a lot more fractures in women, but you combine that with the fact that women's skeletons are on average less dense, less strong than men's, and you can see that fractures from osteoporosis are much more common. And that's ultimately what this is all about. Why do we care about bone health? What's the problem with osteoporosis? Well, if your bones are thin, the bones are going to be more likely to fracture. And they don't necessarily have to have a high impact to fracture. In fact, sometimes you may even have a spontaneous collapse where the vertebrae implodes, for want of a better word, collapses in on itself, which can lead to people losing height. But much more serious than that is that minor trips and injuries, so falls from standing height, which shouldn't really cause a fracture, may cause a fracture at the end of the forearm, like a Colles fracture, or a fracture in the hip, such as a neck or femur fracture. And these fractures can be a major risk. So although part of the risk is coming from the fact that hip fractures happen more commonly in older, frailer patients, there is a significant mortality associated with having had a recent hip fracture. What else could be causing osteoporosis? Well, if you had issues with diet when you were growing up, like you didn't have any vitamin D and calcium, or maybe an eating disorder that may impact the bone growth. Eating disorders not just from your nutrition, but sometimes that can affect periods, and we talked about the importance of the sex hormones on the development and growth of the bone. If you have some other conditions that might affect absorption, so celiac disease, or if you've had conditions like diabetes and other hormone disturbances like thyroid disease, that too can affect the bone health and the bone turnover. Medications that we use can impact the bone health. Medications for epilepsy can sometimes negatively impact your bone health, and steroids. And of course, steroids rheumatologists use for inflammatory conditions like rheumatoid arthritis and other inflammatory forms of arthritis, thanks to the immune activation, all of that immune activity, that itself can thin out the bones. So for our patients with inflammatory arthritis, we typically screen for osteoporosis, especially in people over the age of 50. But you can have osteoporosis without any inflammatory disease, which is why it's important to be aware of this. The other reason it's important to be aware is because I've mentioned it is a silent bone thief. So you probably wouldn't know that you have osteoporosis until one day you fracture. And that's why being aware of your risk factors, whether you suffer from them, or when it might be the right time to get checked out, is important. What do we do? Well, the first thing, if I had someone in my clinic with concerns about osteoporosis, is to take a detailed history. I want to understand their risk factors. When did they first start having periods? Did they do physical activity? What was their diet like? Were they on medications of risk? Do they have conditions that may put them at risk? Do they have a family history of osteoporosis? And then you also want to understand some of the risks of actually fracturing. So do you have visual impairment? Are you frail and with poor muscle mass? Are you likely to trip from balance or coordination issues? These things obviously increase your risk of fractures. And we can use that information to determine your pre-test risks of fracture, and also to decide if we need to do a specific imaging test called a DEXA scan. DEXA scan uses X-rays at 2 different angles to look at your bone density and gives us a score that compares your bone density to what it would have been at its peak, and also to what it would be to someone of the same age as you, same age and gender as you. Once we've got the score, if we've decided to do a DEXA scan, we combine the score and your risk factors, and now we can more accurately predict how likely you are to fracture. It is a prediction, so if you never fall over, or if you're struck down by a bus the next day, no one can be sure that you're going to have a fracture, but we can give you a percentage probability of having a fracture in 10 years. And we know that intervening will reduce that chance. So even though it's a condition that doesn't give you any symptoms, and your rheumatologist is going to prescribe you medications that might have some side effects, it's important to think that not taking treatment puts you at risk of a much worse outcome, which is fracture, hospitalization, potentially surgery to have that fracture fixed, and obviously pain from the fracture. Treatment then, well, we treat people with the bone minerals like vitamin D and calcium, and then we may use osteoporosis drugs like bisphosphonates, which is the most common drug. In other individuals, we may use denosumab, romosozumab, or other drugs which work on the proteins that are involved in build-up or breakdown of bone, or synthetic parathyroid hormone drugs like teriparatide. In some situations, we use specific drugs. We may suggest HRT, estrogen receptor modulators. Very rarely, drugs like strontium might be used. It'll be individualized according to your risk, the amount of bone loss you have, what you've tolerated in the past, and you'll be monitored on a regular basis to see how it impacts your bone health. But you can certainly help by improving lifestyle factors. In particular, alcohol intake, more than 3 units a day, is associated with osteoporosis, smoking, weight-bearing activity, and your diet. So you can work with your doctor to help improve your risks for osteoporosis alongside the medications. I hope you found the video helpful. If you'd like more information on osteoporosis, you can check out the condition page, and there's some more information under the osteoporosis link. If you want to ask any questions, drop me something in the comments. And if you found it helpful, then do like and subscribe to help with the channel's visibility. Thanks.